Hi, I'm Dr. Suzanne Craig from the Perry Centre, and today I've got with me Dr. Alex Perry, who will be answering a few frequently asked questions. So Alex, we've got another question from a patient. Do I get the same points every time, and will my points ever change at all?
It's a really interesting question, and what will typically happen in a consultation as part of that diagnostic process, your practitioner, whether it's myself or Susie or one of the other guys, will work out what points they want to use, what acupuncture points they want to use to try and get the effect that is desirable, right?
Yeah.
So once we've decided on those points, you'll find that there will be some consistency certainly with those points throughout your treatment, particularly from a fertility perspective,
Yeah.
but really for any condition. So the thing that really changes is depends on what your body's up to. So if you came in with period pain and we're aiming for fertility and we're trying to make changes to your period, then you may find that in the first part of your cycle, we're using one set of points. As we get closer to your period, we're probably going to use a slightly different set of points to encourage more movement and pain relief. So the points will certainly change. From a fertility perspective, particularly when if you're trying naturally, then, or even from an IVF standpoint, if you're trying naturally though, we'll have a pre-ovulation set, which are generally, they're quite active points. They're, encouraging strong movement and flow. And then post-ovulation, if you've been trying, and then you find we use a second set of points, and those points are then pregnancy safe.
Yeah.
So we would always presume that if you've been trying and you're post-ovulation, our presumption has to be that you're going to be pregnant. So that whatever we do is going to be safe for you. Okay, so your points, there'll certainly be similarities, but the points will also change over time. And sometimes we have couples come in, don't we? And the bloke and the woman, they're working towards the same goal. In a sense, we're trying to improve their fertility, but they'll often have some points which are similar, and then they'll have their own points as well. So to answer the question, the points will change from time to time. Everybody's points are specific to them and their condition. It's all tailored, but you'll see some consistency as we try and make change in your body.